This giant stack of paper is our family's entire healthcare record since my wife and I moved here December 2023 and had our daughter in January 2024. Prescriptions, receipts, x-rays, everything. Today I'm going to show you exactly what we paid, convert it to US dollars, and compare it to what the same services typically cost in the US. Couple of quick notes, we're using an exchange rate of €1 equals $1.16, which is accurate as of today, and that's been pretty accurate the last few weeks. And a quick disclaimer, US prices vary a lot, but I pulled recent data from GoodRx, Fair Health, and the Kaiser Family Foundation. X-rays in the US typically cost between $100 to $400 per image at imaging centers, and $300 to $800 at hospitals. Urgent care visits are between about $125 to $300, and childbirth with insurance averages around $2,600 to $2,900 in out-of-pocket costs. I'll link the sources below so you know I'm not just making this up. Alright, let's get into it. Section 1. Everyday doctor visits with the Carte Vitale. With our French health insurance card, the Carte Vitale, most visits only cost us between 10 and 20 euros out of pocket. That's because the system automatically reimburses about 70% of the tariff, and the rest is your small copay. I'll give you 3 recent examples from our daily life. One was a visit to our family doctor for a routine checkup. That was 18 euros, about 21 US dollars. We recently had a second visit with our family doctor when our daughter was sick, and we also had to get some forms filled out for Susie and I for the new daycare. That visit was 19.5 euros, which is around 23 US dollars. And about 2 months ago, we had to go to a walk-in clinic, and we saw the doctor who was on duty because our daughter was sick then, about 2 months ago. The reality of having a toddler in daycare. That visit was only 10 euros 50 cents. That's about 12 US dollars. In the US, those same visits would cost between about $125 to $300, and some people pay more than that in their copay even if they have great insurance. Section 2. What about specialists? Not every doctor in France charges the same. If you see a Sector 2 doctor, they're usually senior specialists with big reputations and long resumes. They can charge more than the official rate. For example, Susie's ObGyn charges 150 euros without insurance, which is what we paid for a bunch of prenatal visits with him. In the US, without insurance, a typical visit to a top specialist like this would cost you between $300 to $600. Section 3. Bloodwork and labs. In fall of 2024, my wife's doctor ordered a full panel of blood work to check up on things, see how she was doing, see how she was recovering and whatnot. With insurance, this full panel of blood work, multiple draws, cost 24 euros, which is about 28 US dollars. In the US, the same set of tests can run into the hundreds of dollars depending on if it's ordered through a hospital or done privately. Section 4. Imaging. X-rays and MRIs. My little baby girl was really sick at a certain point last year, and our doctor ordered an x-ray of her chest to make sure there was nothing worse going on. This pediatric chest x-ray with insurance cost us 55 euros. That's about 64 US dollars. In the US, according to the statistics, a pediatric x-ray costs around $280, sometimes up to $500, depending on the facility. Here, it was 64 bucks. So these are my hips, and these are my feet. Technically, they're x-rays of my hips and feet. I had broken my left foot during the pandemic, and as I was walking around, I was noticing a lot of pain, and it was in my feet, both feet, as well as my hips, so my doctor sent me to go get a bunch of x-rays done. This was before my insurance was active. I had filed everything, but I didn't have my card, I was not active in the system yet, and frankly, I was a little nervous about what this was going to cost. But I had to do it, so my doctor knew if we needed to order a specialist visit or surgery, this was a necessary next step. The cost of this book of x-rays, 9 images, was 93 euros. That's about 108 US dollars. According to the data, in the US, this same book of 9 images could have cost between $900 and $3,600 if it was done at an imaging center. And at a hospital, between $2,700 and $7,200. That's a used Toyota. And I paid about $100 with no insurance. Section 5. Midwives or Sage-Femmes. Coming from the US, where we don't really have this category of healthcare in our daily lives, I thought of midwives as essentially an alternative to doctors for, say, home births. But in France, where they're called Sage-Femmes, which means wise woman, and I think that's kind of cool, they're mainstream. They're a key part of prenatal and postpartum care. This example is typical of about 24 of these that I have. This is for a midwife consultation and rehabilitation session with my wife post-delivery. This, without insurance, was €25. That's about $29. In the US, these services can apparently cost between $100 to $200 per session. Section 6. Childbirth. This is the big one, and it may not apply to you, but we're almost done with this video, so stay tuned because these numbers are absolutely insane. And a quick reminder, in our case, all of these costs are without insurance. We were not in the system until 4 months after my daughter was actually born. This example is of a pre-birth consultation with an obstetrician at the hospital. This was to help my wife prepare for what to expect, help us prepare for what to expect with the baby, and do some exams on her, etc., make sure the baby was doing okay. This was €100 without insurance. That's about $116 at the rate that we're using today. Now I'm going to show you the really big one, the hospital stay. Now I'll cut right to the chase. The total hospital stay for us, the facility, the staff, and the delivery, the meds, the labs, everything was €7,753, which amounts to almost $9,000. I'll give you a breakdown of this by category. The 2 shifts of midwives who only cared for my wife before, during, and after the delivery, that was €112. That's around $130. And yes, that's both of them. The nurse who took care of Susie, pre, during, and after the delivery, she was €113, which is about $131. There was an extra doctor on hand until our physician arrived at the hospital and who stayed around to make sure everything went smoothly. He charged €276, which is about $320. The lab work for my wife and then my daughter throughout the entire stay at the hospital, 7 days, that was €105, which is around $122. The second biggest personnel cost was our anesthesiologist. Now, he was what you call a Sector 2 doctor. Sector 1 are doctors who charge only the conventioned rate, meaning insurance will reimburse you 70% of that entire rate. If you have a supplementary insurance, it will actually pay the difference. We'll talk about that in a minute. But the anesthesiologist happened to be a Sector 2 doctor. The conventioned rate was €250. He charged $671, but our cost was €671 for this doctor plus the drugs, the epidural, and everything else that went along with it. That €671 is roughly $778. And last but not least was our ObGyn, who Susie and I both think is the best thing ever. His cost as a Sector 2 doctor and one of the best doctors apparently in all of France in his specialty, he was €2,313, which is close to $2,700. This includes the pre-delivery consultation at the hospital, the delivery itself, and 2 in-person follow-ups, $2,700. The rest of the costs were actually hospital fees for the facility, the staff who split their time between us and the other patients, etc. And we also paid for a private room. The default setup is, of course, a shared room, but we wanted a private room, and we also paid an extra, I think it was €15 a day, for what they called the chaise du papa, which is the daddy chair. Now, in theory, this is a lounge chair in which I could sleep comfortably. In reality, it is by far the most uncomfortable place I have ever slept or attempted to sleep. I had to go back to the apartment a day after Susie delivered Geneva, and my mother-in-law was staying at a hotel down the street from the maternity, so she came and stayed with Susie. I went back home and I grabbed a comforter and a couple of big, nice, fluffy pillows, and I turned that into a bed that I could sleep on without totally throwing my back out. That's my only complaint about the whole experience, and it's a kind of a minor complaint when you consider everything that my wife went through and that we're worried about. We're so grateful that it went well. So in total, we paid a little under $9,000 at a top-rated maternity for a private room, all of Susie's meals, the staff costs, and 2 top-tier doctors, although that didn't include my meal, and the daddy chair. For comparison, in the US, the reported cost for childbirth without insurance ranges anywhere between about $15,000 to $30,000. And even insured families often pay between $5,000 to $10,000 out of pocket, and that's for an experience that is nowhere near what we got to experience here. So right about now, you may be asking, well, that's fine, but what would it cost if you actually had your insurance, if you had your Carte Vitale at the time of this childbirth? In France, from month 6 of pregnancy until 12 days after delivery, Assurance Maladie, which is the nationwide health insurance program, covers 100% of the reimbursable costs at the standard tariff rate. That means that the entire hospital stay, lab fees, doctor and staff fees, the epidural, all of that would have been 100% covered. What's not covered are the Sector 2 markups like our private ObGyn and anesthesiologist, plus the extras like the private room and that fantastic daddy chair and my meals when I was in the hospital. So if we had insurance, our total out-of-pocket costs would have dropped from almost $9,000 to around $3,700. And if we had had a good Mutuelle at the time, which is a supplementary insurance that makes up the difference, it would have been basically free. It would have all been covered. So there's our real raw breakdown. From 18 euro doctor visits today with insurance back to a 7,753 euro childbirth without insurance. French healthcare isn't perfect, but compared side by side to costs in the US, it's like a bicycle ride versus a rocket launch. In a follow-up video, Susie and I will explain how the entire system actually works, from getting your Carte Vitale and how early you can do it, to what a Mutuelle is and how to use it, to applying for and hopefully, in our case, getting reimbursements for care before your insurance kicked in, and a whole lot more. Don't forget to watch this video next if you want to learn about the process of getting your residence card. Don't forget to subscribe if you enjoyed this. Give us a like. Thank you for being here, and we'll see you next time on Shay Davis.